I am John Carlo Josephine Nepomuceno from Southwestern University, Benma, BSN 1, A2. And today I will be doing the health assessment, which is the eyes, HAV, and So first thing we're going to do is to identify the patient. So good morning, I'm John Carlo Josephine Nepomuceno, and I will be your designated nurse for today. May I ask for your name, ma'am, as well as your date of birth? So after that, we will begin to explain the purpose of the HEPP examination. So, ma'am, the purpose of this head and neck assessment is to identify the abnormalities or underlying diseases that you may have between your head and neck structure or any accessory organs, as well as to prevent them from getting worse. Next is to perform hand hygiene.
Dapat ay mo in each pair na sa videographer. Tapos start na mo wala sila din ako dili na ko subsub. Dili ko. Lagi na wala man sila. Amo na lang sa wala man mo yan ang pausak na kaya na ay sa unang pagpapag-alala ko sa hangin kung ang usabi niya ito sige asa mo umay pinapalian na sila first 9 hours second 9 You really have to. Isa may una ninyo perform at ihatag ninyo. Mag-check ka na po na ilabo. Hindi na.
I will use the ophthalmoscope to check the red reflux of the eye. After that, I will be going to examine the
Hindi ka ganitin gusto mo. Matuha dilis.
Showing the feature for identify the patient and see what is the point of today's research. And then after that, we usually stick to 6 stages of methods that I was going to check what you will go to see for abnormalities and underlying pathologies. Before we do assessment, we ask for consent.
So the first thing to do is to inspect the external ear bilaterally and check for abnormalities. After that is to perform an otoscope exam and to perform an otoscope exam, and for adults you will need to hold the ear upward, and then down, I mean back. And if it's a child, you will need to pull it or go down and then back. So since our patient is an adult, we will pull it up and back. And you will need to note any abnormalities. After that is to ask our patient to stand. Can you please stand, ma'am? And we will now use our whispered voice to check for hearing. So, ma'am, can you please cover your right ear? Next, the left ear. Very good. So it is all right. So the next thing to do is to use a tuning fork to perform the Weber's test. So we will strike it. Ma'am, can you hear it from both of your ears? The sound? And if that's done, we will need to strike it again to perform the ring test. Can you hear that now? Is stop?
Right here. So we're gonna make a stand about 20 feet
Did it stop?
Take both your eyes first. We're gonna be trying to bottom line, working our way up. So we're gonna be saying,
Please tell me if it's then did it stop?
no, using one eye.
Okay, so
We're gonna proceed with the assessment of the nose. First, we're gonna inspect the external part.
Then next, I will check the nose area. If there's any.
Be sure you check for the tonsil and maxillary sinus.
Using the otoscope. Using the otoscope.
Speaking of using the otoscope, this is the part that can check the inside of the nose.
There's any.
We're gonna make sure if there are any abnormalities inside, like the breeze, then we're gonna proceed with the back. First, we're gonna check for the temporal mandibular test, putting fingers
So-
on ears and checking for other joints.
So now we will move on to the assessment of the mouth. So first things first is to remove our previous gloves and then perform hand
So we
hygiene.
want to perform hygiene and put on gloves.
And then put on some new clean gloves. Okay, so now the first thing to do is to inspect and palpate the temporal mandibular by putting your index finger at the front of the ear and then ask your patient to open and close your mouth. So ma'am, can you please open and close your mouth? Very good. The next thing we will do is to inspect the lips or the mouth and the oral cavity by asking your patient to open their mouth by using your pen light and tongue depressor. So ma'am, I will now inspect your mouth. Can you please open your mouth? Thank you. Now, the next thing we will do is to inspect the tongue. First, we will need to ask the patient to open their tongue and stick their tongue out. So, ma'am, can you open your mouth and stick your tongue out? Okay. And now we will inspect the sides of the tongue. And then instead you will look for abnormalities. So ma'am, can you please say okay, very good. Now we will need to palpate the tongue for the muscle tone and tenderness. Very good. So that is all for the tongue. And now we will remove our gloves.
Then you wanna palpate
And perform hand hygiene.
that's for the last step. And then next is deep posterior neck. Chest press, palpate the triangular head side to side. Then ear part. They're in a circular motion. And then after that, we're going to palpate it into the front of the ear and back. And then the last is
So,
So now we will be assessing the anterior neck. So first things first is to palpate the trachea.
patient. One.
After that is to inspect and palpate the thyroid glands.
But you already touched your patient. So you have to remember always
Then is to palpate the subclavicular area.
You have to wear your gloves for shaking and you have to wash your hands.
Now we will palpate the thyroid glands.
One minute.
And if it is enlarged, we will use the valve of the stethoscope to auscultate.
There we go. Tama na. Start. So, isa pa. Ikaw naman. Isa may magbitaw.
Now we will do the palpating of the subclavicular area. After that, we will assess the patient's ability to move their neck. So, ma'am, can you move your chin to your chest? Very good. Next to the left shoulder.
Napirma?
Your chin to the left shoulder. And then to the other. Very good. Now your ear to the left shoulder. Very good. And the other shoulder. Very good. So that is all for the anterior neck. Now we will perform hand hygiene. And then we will document the findings.